Today's video is about rheumatism or rheumatoid arthritis. One of the reasons why I'm interested in that particular condition is because it's an autoimmune condition, that it's an inflammatory autoimmune condition. And the reason why I'm interested in that is because I'm also interested in how we can decrease autoimmune conditions in our body. And another element is because probably a lot of you might not know this, but vagus nerve function is involved in that condition, and more specifically, deterioration of its function is involved in the progression of or the development of that condition. And that's the connection. I'm also very interested in how vagus nerve activation could be reducing autoantibodies. I've been wanting to discover this information for a while. I finally have some mechanistic explanation for this, but that will be topic of another video. But I wanted to talk about this as well because just recently a big clinical trial results came out specifically on this topic, and the take-home message was that the treatment via vagus nerve activation was definitely beneficial. We're going to go over these amazing results. So I'll break it all down for you as well. And that's the part that I wanted to understand. How do we decrease these autoantibodies? So wanted to learn this more. This clinical trial was also the second largest clinical trial using vagus nerve activation that I'm aware of. The largest one was also released in 2025. So both of these come from 2025, but the largest one was at the start of 25. It was against depression, and I've covered this area quite extensively, so I wanted to focus on this one first. This came out at the end of 2025. My name is Dr. Mikkel Rashek of Genomics. Let's get started. And the first thing I want to mention is that this video is sponsored by Parasim. This is a company that builds vagus nerve activation devices, the devices that are certified for medical use in Europe. They sponsor me, and I advocate for the use of the device because I get to now study a lot of science on how activation of the vagus nerve helps in a variety of conditions. I have not yet talked about arthritis, so we're going to explore this topic a lot today. So if you're interested in this device, the link to purchase the device at a discount is in the video description below. And let's get going. Let's talk about this clinical trial. This clinical trial involved almost 250 people. It was over 200 people. So while in a sense of clinical trials, that's not very large numbers for vagus nerve activation, which is still very new field of medicine. This bioelectronic medicine is still very new concept. It's quite big. As I mentioned, it's the second largest of the year, second potentially largest ever, and the largest that I'm aware of, at least from what I've studied, was about almost 500 people earlier that year. And these were patients who had this condition for a very long time. I think on average maybe 12 years, and they had severe form of this condition, and no drugs were helping them. So there are a variety of different types of drugs that you can take to help deal with the condition, and in some individuals, just drugs don't do anything for them. So they were a good target to try this completely new concept. And why vagus nerve is because this is a topic we discuss in multiple of my videos, is because vagus nerve has the capacity to regulate your immune system, and specifically via acetylcholine, which is how vagus nerve communicates with the rest of the body. It sends acetylcholine, and our immune cells have receptors to this chemical or neurotransmitter, and they have these acetylcholine receptors, and the downstream effect of this is to reduce inflammation overall. That's the power of the vagus nerve, and that entire process is referred to as cholinergic anti-inflammatory pathway. So that's the key to why this works. Why is this even being tested specifically in this condition? And this These are the reasons why. It's because of this impact. So when I say it reduces inflammation and it reduces levels of pro-inflammatory cytokines, I'll mention a few of them right now just because if I don't forget, we'll touch upon them later. So for example, tumor necrosis factor alpha, that's one of them. When we have a buildup of this molecule, pro-inflammatory cytokine, it induces inflammatory state in our body. It's not just for no good reason. Of course, there are biological consequences for that. And inflammation is usually there to repair some broken situation, but if it's done chronically, then that in itself can lead to problems. So that's one of them. Another one was interleukin 6, and the last one I will mention is interleukin 1 beta. So vagus nerve activation can dramatically reduce the levels of these inflammatory cytokines, and that's how vagus nerve can control inflammation and make sure that we are protected that way. So that is the mechanical way of why we would be interested in this. So what did they do? They took these patients and they measured them. They put them in a very interesting trial that I haven't seen before myself. Now, I don't study lots of clinical trials, so I'm sure it's not like this is an alien format, but I found it interesting because it's the first time I'm seeing it. So they, first of all, how were they activating the vagus nerve? It was an implantable device. So this is, you have to have a surgery, and they implanted a miniature device, maybe the length of a penny, that it was implanted on the vagus nerve, directly right on top of vagus nerve inside your neck. So that portion of the vagus nerve inside your neck is called cervical vagus nerve, and you could, as a consequence, you could control that device via your phone. So doctors could control it via phone. So it's invasive procedure, and patients were stimulated for just 1 minute per day at certain hertz. I believe it was 10 hertz, and then certain amplitude of the signal. I think it was 1.8 milliamps, and that was the control. And then there's half of the patients, they didn't get any amplification, so they weren't getting any signal, and they did this for 3 months. So the 3-month period was comparison between what happens if you activate the vagus nerve that way versus not. So this was proper double-blind clinical trial, randomized clinical trial. So this is like the highest standard level of how you want to be performing this. After those 3 months, both groups had their nerve activated on a daily basis for a whole year. And this is where the power of this study comes in, is because it was followed up for a very long time. And they measured a variety of metrics of performance. There's different ways of assessing the scale of the disease, and then how the disease might be improving because of intervention. So we're going to go through a couple of these. The first one we're going to mention is what they refer to as American College of Rheumatology metric, referred to as, I think it was ACR 20. And the reason why is because you want the intervention, you wanted to see a minimum 20% improvement in the following. You wanted to look at the number of swollen joints, the number of tender joints. So those are two couple metrics. They also, and they were looking at patient assessment of pain, patient global assessment of how well they're doing, doctor global assessment. They were also looking at CRP, inflammatory protein as well. Check out one of my past videos dedicated to vitamin D if you want to get a background on that specific protein. CRP stands for C-reactive protein, doesn't tell you anything. Hence, check out the background video if you want to learn more. But it's a standard marker of inflammation. And they were even looking at health assessment questionnaires as well as the measurement of disability index. So there's a variety of these metrics, and the goal here is to see improvement in the score. And when they measured it for 3 months, so remember, we're measuring for 3 months first, and this is you comparing those who had the vagus nerve activated versus is not, and then both groups had the vagus nerve activated, and there was a stark improvement in those who had their vagus nerve activated. Those who had their vagus nerve not activated, they also saw improvement, and that's the amazing power of placebo. This is the power of your mind, where your mind believes it's being treated. It has the power to literally heal you to some degree. We literally see this in this graph, where there is an improvement in these individuals, where nothing is happening to them, but clearly those who have their vagus nerve activated, the improvement is larger, and you can see the difference was something like 35% score versus 24% score after 3 months. And then afterwards, that the point is that that continuous activation of the vagus nerve afterwards up to a year continuously improved the situation for these patients, to the point where eventually both groups are reaching something like 77% improvement score in this particular metric. All right, so then that was the first one. Well, let's move on to another metric that they looked at, and that one was called, I believe, something like Disability Assessment Score 28, DAS 28. That one looks at 28 joints, and you again look at for swallowing, swelling and tenderness, and you look at also that C-reactive protein measurements as well. So just another metric. They're just different scientific ways of looking at the disease, right? And who knows which one is the best metric. So these scientists, when they're looking these heavy-duty, expensive clinical trials, they look at a variety of them. And again, those who had vagus nerve activation for the first 3 months, they did better than the ones who had a sham, fake activation or no activation, but they didn't know that, right? And there was an improvement right there. I believe from memory, the improvement might have been something like 23 or 24% over 16% improvement. And then the score continued to improve again for the rest of the year. Again, reaching similar values, but again, you see this improvement. And then one more, they used another metric called, and there was a funny name, European League Against Rheumatism. And I was like, who comes up with a name like that? But it's another measurement metric. That made me think, is like, imagine if I ask my YouTube audience if we could call them Nikolai's League Against Science Censorship, you know? But anyway, that's what it's called. And again, it uses that DAS 28 scoring system as well. But there is different output. And once again, there is a clear, visible improvement in the first 3 months. And after those 3 months, when you started activating both groups, again, there was improvement in both groups, and you see improvement in both groups. And at the end, both of these metrics hovered somewhere around 50% improvement at least. Anywhere between 40 to 50 some percent improvement is what we saw at the end of these measurements. So very powerful, hence very promising. What else did they do? They also measured patients' clinical disability assessment index, something like that. And this is where you're looking at, again, the concept of swollen joints and swollen tenderness, and once again you see improvement in these. So we're measuring something that is literally positively impacting the life experience for these individuals. The graph once again shows that there was initial improvement for the activation group over the fake group, and then both groups, when they were activated again, same pattern we're seeing over and over, depending how they're measuring it. You can see there's improvement to the pain that these people were experiencing in their joints, right? And what's interesting here is that while the fake group originally was doing worse than the group that had their vagus nerve activated, once both groups were being activated, the group that was originally fake performed even better, but it wasn't statistically significant. So, but just the graph makes it look like they're doing better. So that was also measured. And the last thing they measured, well, they measured more, but the last thing that I'll mention that they graphically showed is they also they did MRI images to see how the bones are being deteriorated. So with the rheumatoid arthritis, not only can you have swelling of the joints and pain, but you can also have erosion of bones themselves. And they measured that via MRI, and again there was improvement in reducing that erosion just from vagus nerve activation. You could see this initially just between the two groups, but they also, so that they referred to that as global erosion, but they also took a subgroup of these people from the entire study, people who have predisposition to this erosion. So at the baseline, they were already showing erosion at the beginning of the study, and their erosion, they're just more prone to experiencing this. So they're obviously going to be at a higher risk of worse outcomes. And here's where probably one of the best outcomes was observed, because their improvement, and even in the first 3 months when you were comparing people who had their vagus nerve activated inside their neck versus not, there was 50% improvement in that bone erosion. So huge benefit in just those first 3 months, and there was overall benefit for both groups. So what clearly amazing results for this first trial of its kind like this that I'm aware of, and why I wanted to share this with you. So huge benefits, but of course, again, this is an invasive method, and I advertise, promote, and discuss way to activate your vagus nerve that is non-invasive. It's a device that clips to your ear, and there you go, you can activate your vagus nerve that way. So I wanted to see, were there any studies that looked at vagus nerve activation via what is referred to as auricular transcutaneous vagus nerve activation? Auricular meaning via your ear, transcutaneous meaning through the skin, and there were. So, but it wasn't via tragus, how I advertise the device. That's the device that clips to your tragus. That's the little lip that you have on your ear. That's not what one clinical trial investigated. They looked at electric stimulation of your vagus nerve that's in one of those valleys inside your ear. So there's a couple areas inside your ear, few areas inside your ear here, where vagus nerve literally comes to the surface of the skin very close, and there's nothing else but vagus nerve there. So those areas are called concha. So there's Simba concha, there's this one valley divided by a ridge, and there's another valley in your ear. Those are called conchas. One of them is Simba, the other one is, I think, called something like cavum. The names are not that important. This one study, they looked at the time, or it's still the largest clinical trial done for looking at rheumatoid arthritis via electrically activating vagus nerve in your ear, but it wasn't via tragus, it was via sending electrical stimulation in that valley inside your ear. And they measured the same parameters. So they looked at that DAS28 score, for example. They look at that ACR20 score as well that I described to you. They looked at the HAQDI metric as well. That's that health assessment questionnaire that patients can provide. And the take-home message here was that it didn't work. There was no meaningful improvement between the control group and the stimulated group. So that seems disappointing. The first reaction might be, well, maybe they didn't use the exact ideal parameters. And this is older study. This is from 2023. But this year, somebody published a paper discussing that very study, and it was an expert on vagus nerve activation and someone who knows clinical trials, and they mentioned, well, that study, it's not a surprise that there was no visible results. And the reason why is because their parameters that they used should not have worked. The article mentioned is that they used 20 kilohertz magnitude to activate the vagus nerve versus normally the number of hertz, that's at least 1,000 times more than what you would normally use. And this person mentioned, look, when you use low hertz, there's plenty of examples showing that there is some meaningful positive clinical results. And I like the clinical trials they mentioned as an example where this method has actually worked successfully. So they mentioned long COVID, they mentioned headache migraines, they mentioned hand erosion, osteoporosis. They also mentioned tinnitus. They mentioned pediatric kidney disease, and they mention pediatric kidney inflammatory bowel disease. All of these have shown improvement via vagus nerve activation with low kilohertz electric output, versus these authors used way too much. And the person who's responding to this mentioned, like, that's not a surprise their clinical trial didn't work, because we already know that when you have such a high number of hertz, that actually shuts off nerves instead of activates them. So it's not a surprise that it didn't work. What's a surprise is that they used that parameters that they should have known would not work and would fail their clinical trial. So there is an answer to that as to why that trial failed. Too bad. It's just a waste of data, despite the fact that this was such a big and, again, double-blind randomized clinical trial, the type of data we're seeking, we want to have in order to determine exactly how to treat people via activation of nerves. So I kept looking. There was one more that I'm aware of that was transcutaneous vagus nerve activation, but it wasn't electrical. And I wanted to tell you this because this is the first time I studied vagus nerve activation that wasn't electrically stimulated. It was via Vibrotactile stimulation. So many of you talk about vagus nerve massage, and I haven't studied this information before, so clearly I wanted to jump on this. So I want to tell you about this really briefly. How does this work? Well, nerves, they don't just sense electrical stimulation, they have mechanoreceptors, meaning they will sense stretch. If something is pressing on a nerve, they will sense that, and they can lead to activation as well. So this one study looked into this as well, and they use these miniature vibrators, if I can call it like that. They showed this area again, showed this image where they were activating it. They were activating that Simba concha area again, so you can see it on an image. They specifically show you where there is, and they use this pressure and vibrating devices that were specifically calibrated again to have the right hertz amount. So it's not like you can put any vibrating device in your ear and think you're going to be activating your vagus nerve. It has to be right hertz, so it has to be right calibration. But in this particular study, it wasn't a randomized study. They showed a couple of things. First, they took healthy volunteers and they used this vibrotactile way of activating vagus nerve. And what did they show is that they showed that this method of activation of the vagus nerve resulted in reducing those pro-inflammatory cytokines, which is why I mentioned them early at the beginning of the video, the TNF alpha, interleukin 6, interleukin 1 beta. All of these were reduced, not all of these were reduced in the majority of the participants that were studied in the study. So clearly demonstrating that this method that was being attempted to look at how to activate your vagus nerve was clearly working. And then they took 9 patients with rheumatoid arthritis, and they applied the same technique on them. And again, they were able to measure. They measured 2 things. They measured that disease score I was telling you before. DAS28, I believe, was the name, and they showed how people were dropping, and where the score drops to, you can refer to it as the disease, whether the disease is severe, middle ground, low level disease, or whether you even had remission. And both this study as well as even the previous study, remission was seen in some of these patients. So the big clinical trial via the implantable device I mentioned, there were people who even saw remission of the disease. So it's really fantastic results. And then they also used visual assessment score, I think is what is referred to. That's a very simple one. That's literally where you have a line, a straight line on piece of paper, and you as a patient, you assess your own state of disease. And believe it or not, this is actually fairly accurate way of determining how unhealthy a person might be. And they use that simple metric, subjective metric of patients to show that their own assessment also corresponded with reduced disease score via using that vibrating device on the ear surface. Now, of course, that brings me to a question. Okay, what about this massaging technique that many of you talk about? And I gotta tell you, I have not found any literature yet showing this. Not just whether it works or not, I just haven't found any literature even looking into this. So but then that's just my peripheral or primary first search. So like, I haven't spent days and days looking for this, but if you know of any studies that are already published, peer reviewed, that looks into this, let me know. I'd love to learn more. So as far as I understand, right now, I'm not aware of any science that demonstrates that massaging your own ears can help activate vagus nerve. Not that I don't believe it, I just haven't found evidence. And there's some of you talk about massaging vagus nerve via your neck, and that I did study. Although what the study I did look into also mentioned that the improvement that they saw after massaging vagus nerve via neck was the same improvement that was being measured when a person received massage anywhere else anyway. So this was, they measured heart rate variability. Check out one of my videos in the vagus nerve series on the heart rate variability, if that's one of the best way to determine how well your vagus nerve is performing. But relaxation also has an impact on that, and any massage can do this. So whether vagus nerve massage via your neck does this, or is it just because you're getting massage, it might not indicate that the vagus nerve is activated, because that has not yet been conclusively proven. Also, in one of my videos I was mentioning in the past, I mentioned that the vagus nerve in your neck can be quite far away from the surface of the skin. Unlike the vagus nerve inside your ear, remember in those valleys in your ear, why that Vibrotactile method works there so effectively is because that's the area of the body where the vagus nerve truly comes right up against the skin. Even your tragus, the area where I'm promoting activating vagus nerve via tragus, doesn't come necessarily as close to the surface of the skin as in the area of your ear. But the reason why tragus works is because electrical impulse has a deeper impact than just a mechanical pressure, right? So, but I do recall one of you mentioned once in one of the responses to my vagus nerve video dedicated to epilepsy, one of you mentioned how they were massaging their dog's ears when the dog had epileptic seizure to help with the seizure in the dog. And I thought that was so interesting, and that really wanted me to study this more. This is so far what I know about in terms of massage or not, but there you go. There's one study that finally shows that indeed mechanical pressure, provided that it's delivered appropriately, can have an impact. One more thing that I'll mention is side effects. In that very first trial, I should have mentioned that there were some side effects, and they're typical side effects from the invasive procedure. So nobody died or anything like that. They specifically planted it on a left-hand side. So that's my left side on they specifically planted it on a left-hand side, and the reason why is because this way you don't trigger the heart. But nevertheless, some of the patients, their voice started to be affected. They might have had sore throat, and the reason why is because you're activating the vagus nerve fibers that also control your throat. Some people's their voice got really hoarse or just change, or you can even stop being able to talk for a while. But all of these were transient, and that's the advantage of the vagus nerve activation via ear, because you do not activate any of these fibers that go down to the body. You only activate the fibers that go to your brain and process that information, and then they send appropriate response to the rest of the body. All right, so that's everything I want to tell you in this bigger topic dedicated to arthritis. And clearly this is an emerging field. Oh, and I will mention, I have not found any clinical trials yet using the tragus activation, vagus nerve activation via tragus for arthritis. And to me, that only signifies that how early we are in this field of looking into this and exploring this area. Clearly it's just starting. And again, it shows you so many promising results. This is why I'm so into vagus nerve. Not that I have not started finding some potential dangerous aspects of vagus nerve activation, and I will be exploring that in some future videos. And that danger so far comes in one type of form of condition that I'm aware of for now, and that might be cancer. And not just any cancer. Vagus nerve activation does show extremely positive results for cancer in general, but there is also a flip side to it, that in some situations it might not be the best. And I'll explore that in future videos, because I have not really yet opened up this field of discussion with you when it comes to vagus nerve and cancer. So stay tuned for that in the future as well. For now, what I'm gonna say is, please like, please share. This is how we grow. Please subscribe if you haven't already. Please leave a comment below. Let's have a conversation. I try to answer as many of comments as possible. Impossible to answer all of them though. And also check out my Patreon. This is my private channel. You can be a free patron, or you can be sponsoring patron, so you can be paying patron. And there's a couple things about the benefits of being patron for everyone, free and sponsoring patrons. Now I'm asking all of you for the advice as to what it means to lead a healthy life. What metrics should be all considering in order to improve our healthy living lifestyle? I just want to know what it means to different people and create a cheat sheet. So there's that. And then sponsoring patrons, they also vote which content that I produce eventually makes it to YouTube. So that's another thing. And there's some free stuff on Patreon always as well. So I'll see you guys next time, and take care for now.